Hi, I'm Jerry Hesch, Dr. Hesch, a physical therapist at the Hesch Institute in Aurora, Colorado. And this is part 2 on my client. We just posted another video on her showing that she presented with what we call a right anterior ilium, what we call a left sacral torsion, and some restriction in the 6th rib. We had her do the most simple treatment, and that restored mobility in the pelvis. And I like empowering the patient, making them independent, and understanding that they can treat this themselves. They don't need to keep coming back and seeing me. She's going to do this a couple of times a week, and that will be sufficient to keep the pelvis with normal mobility. And we did see in walking where her pelvis shifts over to the left side, and that certainly is not normative, and over time that might have an adverse effect on hip joints or knee joints or even ankle and such. So we do want to restore normative mobility through the pelvic structure, even though there's a lot of controversy about that subject. But let's have you lie on your back, and would you show us what you did to correct that? So she hugged her right knee outside the shoulder for 2 minutes. And this is a wonderful self-treatment for an anterior ilium. Good, and then put the leg out straight. And you'll notice, if you compare to the prior video, I can now take up the slack through the pelvis, and I can now spring that. And let's have you sit up and face that way. And she presented with what we named a sacral torsion, and the left lower quadrant of her sacrum did not move. And in response to her doing this treatment, she has easy movement through that structure. All right, so now I want to show you a lower pelvic evaluation. Let's have you lie on your stomach. And what we find by palpating the bottom of the pelvis, excuse me, the ischium, is that her left ischium is posterior towards the wall. Okay? And when we palpate the medial aspect, and you might bring the camera down to her feet, when you come in to the sit bones here, she has a narrow space from the right sit bone to the midline crease of the buttock, and you can see a generous amount of space on the left side. Now some people, their pelvis simply develops this way. So for those folks, we can't treat it, we can't change it. But in this example, she has blocked spring mobility on the right sit bone, on the left sit bone, and also on the right sit bone. And these tend to be stuck at end range. There's no movement going to the left, no movement going to the left. Consistent with this pattern is that she has a left side bent coccyx. And these ligaments are pulling it in that direction. So straightening out the lower pelvis is important. Now I have other videos on this pattern. It's called a lower windswept pelvis. So I'm not going to give a lot of detail. But the treatment is basically stretching this right hip outward into abduction, stretching the left hip into adduction to bring that medially. And I sincerely believe this pattern does involve a little bit of movement through the SI joint, but primarily it's movement of the whole pelvis and movement in the hip joints as well. There's also a rotational component because this ischium is higher to the ceiling than this one, and yet there's normal spring when I go anteriorly, and that's because there's also this rotational element. So part of treatment will also be to rotate this hip internally on the right and rotate the left hip externally, and I'm going to go ahead and treat it now, and then we'll film the response to treatment. Thank you.